Hi, this is your health snippet right here on Hey Doc with me, Dr. Katie. Colon cancer usually develops from small growth called polyps. These form in the inner lining of the colon or the rectum. Over time, some of these polyps can become cancerous, which may spread to other parts of the body if left untreated. In this video, we will talk about important signs or symptoms of colon cancer. But before I go on to describing what these signs and symptoms are, it is important to realize that some of these symptoms can be caused by other conditions as well. However, if you do identify some of these symptoms, it is important that you see your doctor as a matter of urgency. The first symptom is a change in bowel habits. This can be a change in frequency, consistency, or the actual appearance of the stool. For example, if you are frequently having diarrheal episodes or you're having short intervals before diarrhea reoccurs. The other extreme can also be a sign of colon cancer, and that is overwhelming constipation that leads to a great deal of bloating and abdominal discomfort. Bright blood or dark blood appearing in the stool can be a sign or symptom of colon cancer. However, blood appearing in the stool can be because of other conditions such as hemorrhoids, fissures, or irritable bowel disease. The other symptom is consistent or recurrent abdominal pain, especially if it's associated with blood in the stool and a change in bowel habits. But do bear in mind that the abdominal pain can also be generalized. Then there is unexplained weight loss. Most of us perceive weight loss as a good thing. And in fact, it is, especially when there are health concerns such as obesity that then cause high blood pressure and affect the kidney and can lead to diabetes. But unexplained weight loss is not good news and should always be investigated. So if you have noticed that without much exercise or without being intentional about your weight loss, your clothes are starting to feel looser and looser and you are actually losing weight, this may be a sign of colon cancer. The next is a sign that your doctor should pick up and discuss with you further. And that is unexplained iron deficiency. So, for example, if you go and see your doctor for routine bloods, just to make sure that you are generally in good health, and you go back to your doctor to discuss what those results are, and your doctor tells you that your iron is low. If you do not have a reason for low iron, that means that you are not excluding dietary sources of iron in your diet. For example, you are a meat eater, you eat meat as normal, you eat plenty of greens, or you are, as a woman, you are not having heavy periods, you're not losing too much blood when you're menstruating, or for men and women, you're not bleeding through your back passage. But despite all of these not being true for you, your iron still is low. That is known as unexplained iron deficiency, which, if not addressed, your hemoglobin will also become low and you will become anemic. When this happens, your doctor should think, could this patient have colon cancer? So in cases of unexplained iron deficiency anemia, your doctor should prompt you to get further investigations to rule out colon cancer. And last but not least is the very vague symptom of feeling tired all the time, fatigue and feeling weak despite adequate amount of rest. When you have done all the possible investigations that your doctor has recommended to further investigate why it is that you are feeling tired all the time, and all of these have come back as normal, it will then be a good idea to discuss with your doctor whether or not you should be investigated for possibility of colon cancer. Now, I will mention that the gold standard to investigate whether or not you have colon cancer is through carrying out a colonoscopy, which is a camera that is put up the back passage and looks at the integrity of your colon. I will mention here that colon cancer, especially in the early stages, can cause no symptoms to the patient, which is the reason why it is important to take part in the regular screening program that is available in your country. The screening program in countries like the United Kingdom and Australia is the fecal occult blood test, and the screening age varies between countries. Those who have a higher risk of developing bowel cancer, such as those with a very strong family history of colon cancer, those who have had suspicious polyps removed in previous colonoscopies, should be screened much sooner than the national screening age. This will help to detect any cancerous cells much sooner when they are most treatable. That's it, guys. Thank you for watching another video. Do remember to smash the like button, to subscribe. This will allow more people to come into the knowledge of what we do right here on HeyDoc and help us to continue to bring you content that is helpful in supporting you in your healthy living journey. Take care, and we'll see you in our next video.